Hi, everybody. Just give us a quick minute or so. We expect a decent amount of people. We want to make sure everybody has time to join. So for those just joining, it'll just be a minute or so. Thank you for joining us tonight. I think we'll wait till about 6:32, Dr. Langston. If you're still just joining us, we will be getting going in just a second here. Just want to give a couple people a few more seconds. All right, let's go ahead and get going here. Welcome, everyone. Thank you for joining us tonight. Please, thank you for joining our Men's Health webinar. I'm Preston Brickner. I'll be your host and moderator. We're going to start with a couple quick housekeeping items, and then I'll turn it over to our speaker. First, your attendance tonight is completely anonymous to the other attendees. No one can see your face nor your name. Any comments or questions can only be seen by myself and Dr. Langston. If you wish to ask a question, just go down to your chat box. It should be at the lower part of your screen. You be sure to include, we'll do our best to include them in our Q&A session at the end of the presentation. Our presentation tonight should last about approximately 1 hour with question and answer period, and it's presented by Dr. Joshua Langston. Dr. Langston is with the Urology of Virginia. Dr. Langston, take it away, sir.
Hi there, everybody. Preston, you can hear me okay?
Yep, hear you loud and clear, sir.
Great. Well, look, I'm really glad to get to do this. So thank you to Preston and Boston Scientific for helping to arrange it. We've got a lot of people on, and that is great because this is a chance to really get to talk about topics that matter a lot to men and to couples and relationships. And I had the chance to be on the Hampton Road Show yesterday to talk about this a little bit, and I thought it really kind of came together. It's on how much this part of life, men's health, men's sexual health, matters to a man, to their identity, to their sense of self, their sense of manliness, their vitality. It matters to relationships. And is a big part there, and it matters to your mental health and so many things beyond what people might think it matters for. And so but also it's a topic that is hard to discuss with other people, especially something you may have never had to talk about with anyone else so openly before, and yet it's what I do all day every day. So it's it's nothing scandalous for me to talk about, but I think it's hard for some folks. And so I'm glad that we could do this in the webinar format. You're in the comfort of your own home, anonymously getting information, hearing about what's out there. And, I think that there's so many things that we can do for men and again, for couples who are dealing with the things that come with the process of aging as a man. And so I'm really glad everyone was able to join, because I just hate to think that there are men out there suffering from these problems who are not aware of, or just are not able to, because of embarrassment or just reluctance or whatever, able to seek the treatment options that we have. So really glad that we can do this, and we'll try to get going. I do want to respect your time because I know you have busy lives, but I want to get to roll through this stuff here. By way of intro, there's my picture. I look a little older than even when I was that picture was taken, but I went to school for a long time, and again, I'm doing it and but I can't put all that to use if I can't get you guys, and was lucky enough to do that over in the UK. And I do a lot, if not at this point, most of all of the Men's Health Sexual Medicine for Urology of Virginia. So we'll start off, we're going to cover a lot of men's health, but we're going to talk about erectile dysfunction. So what is it? Well, it's the inability to achieve or maintain an erection suitable in your own mind, whatever that may be, for intercourse the way that you want to be able to do it. It is common. About 1 in 5 American men will suffer from it, and over half of men over the age of 40. It affects 39 million men total. So what is it? Well, the penis, while it may not seem all that sophisticated, is actually a very complicated structure, right? So it's actually got this tissue on the inside that's the consistency of a kitchen sponge, and it's able to fill up and become very, very full of a fluid, which is blood, right? Until it's so full of that fluid that it becomes pressurized and rigid. And the body manages all that with a very intricate combination of nerve signalings from the brain down to say, hey, make this happen. And then from being able to turn on the faucet of blood flow and pump it in and trap it there. And any point along that process gets messed up because of age and other disease states and other medical problems, can throw this all off. And it's very easy to throw it off with a lot of the different ailments that are so common in America today. And so what are the main causes? Well, it comes down to vascular. Again, the blood flow being a key point there. You cannot build that pressure up if you can't get the blood flow in. Diabetes. Well, how does diabetes affect this? I mean, that's sort of interesting. Why would that have anything to do with it? Well, that diabetes actually really ravages your nerves. And maybe if you have diabetes or those that do, they can get what's called peripheral neuropathy, or loss of the nerves in their hands and feet, lose sensation. The penis is no different, right? It's an end organ very easily to the point that it can affect the quality of erection. So medication certainly can. And then a big one is prostate cancer, right? So the treatment of prostate cancer, either by surgery or radiation, has a devastating effect oftentimes on sexual health. And again, the huge part of what we do and what I'm passionate about doing is just being able to restore back from men what the cancer has taken away from them. It also can show up as a precursor, and this is something I hit up as well on the Hampton Roads shows, that sometimes this is the canary in the coal mine. The ED comes, and it's actually the symptom that tells us there may be something deeper going on. So maybe there is undiagnosed heart disease, maybe there is undiagnosed diabetes or vascular disease, and you need to know about that, right? That's the life or death kind of stuff sometimes. And so sometimes coming in and addressing the superficial symptom, which is a change in your sexual function, can actually help us. We can dig down and find something deeper that may be more meaningful to life and death. We talked a little bit about diabetes, just to hit on that again. 15 million men in the US have diabetes, and therefore are certainly at risk of this. And one key thing with diabetes is, because again, it's a nerve signaling thing. We've all heard, and we'll get to this in a minute, but the pills that are out there like Viagra, Cialis, et cetera, those pills help increase blood flow. But with diabetes, the problem is the nerve signal, right? It's not a problem of blood flow. And so men with diabetes, which again, very, very common now in America, are not responsive to the pills. But most doctors out there, that's really all they know how to give. They don't know kind of what the other options are. And so it's really unfortunate for these men with diabetes, because it's not really addressing the underlying problem of why they have the ED, which is more the nerve problem. So they're less responsive to medications. The ED is more severe and associated with decreased quality of life. And again, we think in many, many cases, ED is the presenting symptom for undiagnosed diabetes that we dig deeper. And so we talked about the nerve damage. We talked about the damage to the lining of small arteries, and then we also talked about when the combination of nerves and blood vessels are damaged, you're not going to have that appropriate response to generate the pressure and the response needed for an erection. And so I think we've covered all of that. And so for factors that can increase ED, this is going to happen as you get older. It's going to happen based on the control of your diabetes. That's a huge one, based on your hemoglobin A1C and your overall diabetic control. and then any other kind of disease states that you have going along with that. Usually it's not uncommon at all to see some blood pressure and other heart disease, and medications then start to come in, because then your very well-intentioned doctors putting you on medicine for your blood pressure, for your heart disease, for your diabetes, for everything else. And then, oh, what do you know? Those have a negative impact on your sexual function on top of the damage that the diabetes has caused itself. So a lot to think about with diabetes. Now, if we move to heart disease, this is really interesting, and I don't want to be alarmist about it. Obviously everyone that's logged in here today has, some interest in this topic, may have some problem along these lines. I don't want to, in any way alarm you that you are definitely on the road to one of these other disease states. When I say that things can be underlying, that's only some of the time. It's not all the time. But there is some very interesting data about ED being a presenting symptom of heart disease. So an independent risk factor, so in medical lingo, that just means by itself can represent an indicator that you are on the road to heart disease. And again, for us, all that means is that in some men who come in, we try to screen pretty carefully, along with actually the cardiologist in Hampton Roads. We worked together with some really wonderful cardiologists and came up with a screening tool for men that come in to see us for ED, and we'll determine when we need to actually send them over to cardiology because they are seemingly at risk for heart disease. So another good reason to come in and talk to us about this. ED of some kind precedes coronary artery disease in about 70% of the time. And the reason why is because if you think about the arteries of the heart, right, the coronary arteries that are the ones that get clogged up, and that is what a heart attack is. Well, you've got slightly smaller vessels down in the penis trying to pump blood in there. And so if you're, the smaller blood vessel is going to get blocked up first. And then essentially the idea being you're a little bit on the clock to the bigger vessel getting clogged up. And so that is the hypothesis, and there is some definite data out there to support that. Again, heart health is important, and for any reason that we can convince you to increase your heart health and your diet and lifestyle and weight loss and quit smoking and reduce stress, it's worth it. And honestly, this is a great reason, right? This is an important part of life to men. And what I say is, ED is kind of a gateway. It's like a gateway drug, right? That's what gets men in the door. And sometimes we can intervene in some real meaningful ways to prevent coronary heart disease, coronary artery disease, and other things like diabetes. But we can really encourage you to make progress on that with diet, exercise, weight loss, et cetera. Let's talk a bit about testosterone. I can talk on this topic alone for several hours, so you probably don't want me to do that tonight. But Preston will stop me if I get going too much. There's so much out there about testosterone.
We have a little technical difficulties, everybody. Just give us a quick second. Dr. Langston, you still there? Hold real tight, everybody. We will be just 1 second. Give me 1 second, please. Hang tight. I'm on the line with him currently. Oh, there you are.
Can you hear me okay?
Yeah, I can hear you fine. You froze up right after your great joke about
sorry
me
about
cutting
that,
you off
guys.
on low T, and then
I had lots of good jokes after that, and you missed them all. Let me see if I can get back to it restarted the.
let me know. I'm going to pull it up right now on my own as well.
Do you have it there?
Yep.
Okay. I think many people share my frustration with the predominant internet provider in Hampton Roads, so my apologies. But so testosterone, yeah, it's again a long topic that we can't cover all tonight. Is it linked to ED? Sure, there is certainly a connection because they're both important aspects of overall men's health. But and so what is it? Well, it's obviously going to be more common. Well, maybe not obviously, but it's going to be more common in men as you gain weight, as you add on disease states like diabetes, high blood pressure, high cholesterol, et cetera. And we know it's very, very common because all of those list of things are becoming more and more common in America. So the number of men that have low T is going up. And there are good treatment options for it, gels, patches, injections, and there are pills actually, which are relatively new on the market. Actually, it took them a few decades to come up with a pill form of testosterone that was reasonable. And so that's actually the newest way of getting testosterone to you. But there are easy treatments for that. And so testosterone, it does not cure ED. It does not fix ED. It is more linked to libido or sex drive, and also to your energy level and vitality and exercise tolerance and those sorts of things. However, I do think it's very important. And in fact, all of our guidelines recommend that if a man comes into the office to talk about ED, that you should check testosterone. Because again, they are very much linked, and you're going to respond better to treatment for your ED if your testosterone is normal. So if it's low, we need to raise it up and get it in normal levels, the normal range. And then you'll respond better actually to your ED treatments that we try. And so it is an important piece of the puzzle, but it's not by itself going to fix the erections. When we talked briefly about it, and we'll get back into it here again with the treatments, but the problem of ED is a hydraulics problem. It is a fluid pump hydraulics problem. And so we do have solutions that are targeted to that for that problem specifically. Prostate cancer. So again, we talked about that the primary drivers of erectile dysfunction are going to be either a problem with the blood flow or a problem with the nerves. And so treatment for prostate cancer can really knock out both, going to leave almost every man with some degree of impact there. Not a problem. We can absolutely fix it. And whether it's you or somebody you should never hesitate to treat prostate cancer because of a fear of what it will do to you in your sexual function or other urinary function or any way. And so again, what I do for Urology Virginia is I help to address all the quality of life concerns that come after prostate cancer treatment. And I can promise you that we can fix all of those things with very straightforward solutions if they are needed. You should never hesitate to address screening for prostate cancer, which is the PSA blood test, or treatment for prostate cancer out of a fear of losing these parts of life, because I promise you, you won't have to at all. We can certainly help with that. And you can see the diagram here. The prostate, sort of a strange picture, but here's your bladder, and below the bladder sits the prostate, and then that flows on out into the urethra. And so when you go in and remove the prostate, or when you radiate it, you're still hitting this same area. You're zapping a lot of these nerves, or you're at least partially stunning or in some way damaging those nerves. And so the technology and the treatment for prostate cancer has vastly improved over the decades. And the techniques that are used now are so much better at sparing those nerves and not damaging them than they ever were before. But this is the rationale behind why some men have some degree of impact to their sexual function from treatment for prostate cancer. So it's going to affect almost everybody, 25 to 75%, and certainly after radiation as well. The effects can begin immediately after the surgery, and then those nerves can recover over time. That can take take up to a year or more. But we actually have these men all along so that you never actually lose the ability to maintain this part of life, even as you work through that recovery. Peyronie's disease, this is actually more common than you might think. This is a scar tissue that forms in the outer casing of the penis. So, we talked about that spongy tissue. It's got a very tough outer casing that is around the outside there of that spongy tissue. And if scar tissue forms in that, well, then that scar tissue doesn't stretch, doesn't elongate when the rest of the penis elongates for an erection. And that causes a potential curvature, as you can see here. So the scar tissue is here. This spot here doesn't want to elongate like the rest of the tissue does. And so it causes the penis to curve upward. So that can lead to a real problem of inability to really engage in any kind of intercourse, difficulty achieving or maintaining the erection at all, anxiety and stress. It's actually one of the top 5 most psychologically impacting problems, medical problems across the board. So they looked at all medical problems that a person could have, and this problem from the psychological impact was in the top 5, and so it's a huge impact there. And so we do have good options for that all through, and I don't want to spend too much time on it now, but just know that it is more common than we once thought. Probably 10% of the population. Again, it's what I see all day, every day. So to me, it's very common, but plenty of guys coming in, again, a very, very, uncomfortable thing to come in and address, but we can certainly help. I do want to spend a lot of time then on the treatment options and make sure we save plenty of time for Q&A. So starting first, actually, and kind of working our way from things we shouldn't do necessarily to things we should. There's a lot out there, and there's an increasing number of places just around town here where they're offering things like extracorporeal shockwave therapy, intercavernous. Our goal of our team is to be on the cutting edge of anything that is out there that is valuable to a man for this part of their life. And I can tell you that at this point, these things have not been shown in studies to really improve this aspect of life for men. They're certainly not covered by insurance, and they're very, very expensive. So, it's something that we are aware of and we support the study of. And in fact, there's some very, very smart people around the country, and we've tried to get on various trials and haven't yet, but we'll continue to look at those to do some of these things. But at this point, the evidence does not point to this being in any way really beneficial. The only thing it's going to hurt is your wallet, because it's incredibly expensive. The places that are, again, out there looking to make quite a bit of money on this, but it's not necessarily going to help that much. Now, people do have benefit from it, so they claim, and maybe that's real, and maybe that's wishful, right? I mean, if you spend thousands and thousands of dollars on something, you really do want it to help you, and I understand that. And there's no harm in trying it if you want to, if you really have that cash and you want to pursue that. But again, no real proven evidence. The evidence, so for these devices and these options is much more solid. And starting from left to right, there are oral medications. I'm sure everybody's at least familiar with those or has tried them. We have injection therapy, where we actually teach and train you how to inject medication into the penis. Vacuum erection devices, urethral suppositories, and then a surgical option called the penile implant. And we'll go through these a little bit. So the oral medications, as I mentioned briefly earlier, they work by increasing blood flow, right? So when the situation, again, is one of blood flow issues, so the nerves have to be working pretty well, but if it's a blood flow issue, then these medicines will help with that. So if you take the pill and it gives you an erection, you take the pill, and then what it's going to do is it's going to allow improved blood flow everywhere, head to toe in your body. And then when you give that signal again, which starts up in the brain down through the nerves to generate the erection, it's just going to be better blood flow than it would have otherwise been. And so are they effective? Yeah, generally, and certainly worth trying. They can be affected by food intake. They do have to be taken ahead of time. So it does affect the ability to be spontaneous. And then the common side effects are headache and facial flushing. And so what I mentioned was they increase blood flow everywhere. So just like they're going to increase blood flow down there, they're going to increase blood flow up in the head. And so some guys will feel kind of flush in the face or have a headache. It's not harmful. It's not bad. These medicines are really, really safe. I know there's a lot of stigma. I don't know where it comes from, honestly, that they cause heart attacks or something like that. They're good. I'm certainly glad they're out there, and they do a lot for a lot of guys. But they almost half of men who with ED who try their own medications will give up on them because they'll either stop working or it doesn't really work for their circumstances. And then especially the men with diabetes, much more likely to move on to other options. So intracavernosal injection, this is always a dicey one here. This is where we actually teach and train you how to inject a medicine directly into that spongy tissue that will really kind of go right to where it needs to be and supercharge the ability of the body to pump that blood in and trap it there. Now, nobody has ever come in to my office and said, "Oh, good, I've always wanted to do this. I finally get to stab myself in the penis with a needle." And obviously it has its place. And what I say for all of this when I talk to guys is, you have to decide if this is right for you. I cannot decide and have given up trying to guess what guys are going to go with, right? Because every relationship, every situation is different. People's preferences are different and their circumstances are. For some this is great, and for a lot it's not. So it is a situation where we teach you drop the medication home, inject it into the penis. It works within about 5 or 10 minutes. It does generally work. We can usually dial up a dose initially, at least that'll work for you. It does have a pretty high discontinuation rate. Ultimately, either because it stops working over time because of further and further deterioration of the blood flow, so it can't quite pump it up enough, or because again, just guys just kind of grow weary of having the process and the technique. You generally have to keep it cold. So if you travel, you have to take it in a cooler. You got to stop what you're doing and do it. But then again, if it works for you in your circumstances, your relationship, maybe this is the answer for you. We do generally encourage you to consider it, certainly along the way of looking at all the different options. A vacuum pump, penis pump, whatever you may want to call it. This is a cylinder that goes down over the penis and actually uses kind of the laws of physics. It creates a vacuum which pulls blood from the body up into the penis. And then you have to have a big rubber band that is initially on the cylinder that rolls down, and you kind of pop down around the base of the penis to trap the blood there. In my mind, this is not a viable treatment for men and for relationships where they're actively engaging in regular intercourse. We do use this in certain circumstances for rehabbing the tissue, for trying to keep the tissue healthy. Remember that spongy tissue, and it needs to remain healthy if we're going to be able to restore erection. So in some circumstances, we'll have guys actually use a vacuum pump to kind of create that erection, to kind of remind that tissue to stretch and pull blood in. And so, but realistically, the satisfaction rates for the urethral suppository, hope you can still hear me. I just got another message that my signal was unstable. The urethral suppository is not practically used. It's actually it's like a pill that you put down the urethra, down the water pipe, and it dissolves out from there into the penis and seeks to generate an erection that way. Historically, it's been around for a long time. Practically speaking, no one really utilizes this unless it's sort of for certain circumstances, but not again for the average guy looking for a solution. The penile implant. So this is a surgery that we do. And it's something where, again, everybody has to choose what's right for them. And I think universally, if I had to meet you on the street and try to tell you about this, it's very, very difficult to kind of explain. I generally do it in the office with the model in my hand that you can see what it is and you can see how it works. And it turns out, hey, this is very simple and very straightforward. I think we can accomplish that hopefully here with the diagrams that you'll see. But as I mentioned, the penis has a chamber on the left and on the right, which is filled with that spongy fluid. And when you were younger and things were working well, it would fill up with that fluid until it became completely so full that it was rigid and became pressurized and rigid. All right. And so if that's not working and the other options aren't working or aren't really a good fit for you, then what else could there be that would work? And so this device is actually ingenious and was developed about 50 years ago. Exactly. Actually, we celebrated 50 years this year from when it was devised, and it's gone through a million revisions since then to come to the very sophisticated product that we have today. But the idea is that we can actually put a cylinder, let me go back to this picture, a cylinder into each of those chambers that are already there, right? There's one on the left, one on the right. So we slide a cylinder into each, and it's an inflatable device, right? It's an inflatable cylinder. It's just glorified balloon, right? And we're going to do the same thing that happens with the natural erection. We're going to fill it up with the fluid when you're ready. And when you want to have an erection, you're going to fill it up with the fluid. But instead of it being blood, it's going to be water, okay? But it's going to accomplish the same thing. You're going to fill that chamber up until it becomes so pressurized with that fluid that it's rigid. And it allows you to do what you want to do in exactly the same way. And so the water that you're going to use is stored in a reservoir tank, which we place in deep inside the body where you can't feel it or know that it's there. And then you have a small control pump, which is hidden down in between the testicles and the scrotum, right? So all of this is on the inside of the body. And you're able to reach down just and feel it through the skin of the scrotum and control it from there to control the inflation and the deflation of the cylinders that are in the penis. So when the cylinders are deflated, the penis is, and you're using it just to urinate, the penis is soft and squishy and flops around and works just like it always has. And when you want to have an erection, you're going to use the control pump down in the scrotum to transfer the fluid from the storage tank here out into the cylinders until it's pressurized and rigid. And so as I tell guys, especially anybody that suffered from ED, has experienced this, there's two separate processes going on, because you can have all of the mental, psychological aspects of sexuality. You can have all of that all the way through orgasm ejaculation in the essential absence of any real erection, right? Or very, very poor erection. So it must tell you that there's actually two separate things going on. There's the pressure fluid flow issue, hydraulics, as I like to use that word, right? And then there's the sensation and the mental aspect of it and the pleasure aspect of it. And so, if it ain't broke, don't fix it. We're going to go in with this procedure and we're going to address the hydraulics part, and we're going to leave the rest of it alone. And, if I can give men a little bit of a hard time, our mind is not smart enough to really know why the thing is hard. It just knows that it is. And so, it's just, but again, it really has to do with the fact that we're just addressing the hydraulic problem. We're not messing with any of the rest of that. We get the procedure done in a way where we stay away from any nerves. And therefore I, confidently can say we don't change anything about sensation or how it feels at all. And it's really remarkable at how well it recreates the natural erection. I mean, it's really pretty amazing. So I do a lot of this type of surgery, and I tell every guy, I say, I don't want to sound like a salesman at all when I talk about it or when I talk about any of these things. But, at the same time, I have to take the hundreds of guys that have been through this, whatever treatment, whether it's the pills, the injections, or the surgery. I have to kind of package up the successes that they've had, the satisfaction and the fact that it's worked well, and they're given this part of their life back. I've got to kind of package that up and try to deliver that to you while you're still sitting there trying to decide what's right for you, And so I do sound a little enthusiastic about it, but that's because I've seen so many lives changed through it. And so we do this surgery on an outpatient basis. It takes 1 hour to do. You go home right afterward. Take it easy. I don't want you laid up in bed or anything like that. You take it easy for a few days and get back to a pretty normal life. And then kind of you're off to the races through that process. At 7 years, 94% are still working fully, 80%, we think at about 15 to 20 years. And of course, the devices have gotten better and better every few years. So we expect them to be lifelong and a really great thing for men. So you can see here when the cylinder is deflated, as I talked about, versus the inflated, we need to update this, right, Preston? We hit 50 years, and this was the year for that, and got actually this year, because of the 50th year at one of our national meetings, we had some great stories on the history of the device and the pioneers that developed it. So it's actually pretty fascinating. Here's a nice video, I think, to see who did it better, this animation or my explanation. So you can see you're going to feel through the skin. You're going to press that pump. That's going to transfer the fluid out into the cylinders. And it's going to do exactly what the natural erection did. It's going to fill up those chambers until they're completely full and pressurized. You're able to do what you want to do. And when you're done, you're going to hit a button at the top. That's going to release the fluid out of the cylinders, pump it back up into the reservoir where it'll be ready for the next time. As I said, I do it as an outpatient, small incision, few days to return to normal activity, 4 to 6 weeks to start using it. Another thing too, I was talking to a guy a couple of days ago. He said, "Oh, that's got to be really expensive." So it's actually very well covered by insurance. It's certainly covered by Medicare. Again, if you've got insurance that you pay for and you have been paying for a long time through your work, you should let it work for you. And so again, talking about all these treatments out there that are very, very expensive, that you go and pay cash for, come talk to us. Let us go over this. Let us, if you're interested, let us see what your insurance coverage would be. Again, it is covered by Medicare in almost all cases. I know this says maybe, but I think it's essentially, in my experience, always covered. And so, let your insurance work for you and help you out in this regard. These are guys that are giving their honest opinion of things, who have had the device for quite a while. John on the left, 14 years, first time for surgery, which we hear a lot, very nervous. Recovery was easy. It's been great. And it gives you that part of life back. Cliff, again, 10 years with the device. You're not alone. There's light at the end of the tunnel, and will give you a new outlook on life and your personal relationship. I saw a guy recently, and he said, people think this is about sex. This really isn't even about that. This is just about feeling whole again. And it's really rewarding to get to help guys out, and just see that it kind of is in their minds, right, restoring such a huge part of life for them. So huge amount of patient and partner satisfaction. In fact, the partner satisfaction is higher, which I think is amazing, right? So just by 1 point, but still, I think it's really significant, right? Because this isn't worth doing if it's not good for everybody, and it's not sort of, again, furthering the goals for you and your partner. And so I think we've covered a lot of this. It is covered by insurance. It's long lasting and durable, and it is again, very natural and normal when it's in the deflated position, and doesn't affect anything about the sensation of the other experience. It goes where you go, and it's ready when you're ready. And that's another big thing I've learned from patients over the years. All the other things, whether it's pills or even the shots, sometimes they work, sometimes they don't. You got to carry something with you when you travel or all that. This is, once it's in, it's ready to go. Anytime you're ready, it's ready. And once you learn how to use it, it's going to work the same every time. So, I think one of the really psychologically impacting parts of ED, even if you have a treatment that does work for you sometimes, is that they can all be hit or miss. And so I think the fact that you can know that this is going to work without any anxiety about, are we going to get kind of down the road on this, and then all of a sudden it's not going to work. You don't have to worry about that. And I think that's a big plus. So I don't want to belabor this too much, but I did want to get a chance to talk through it, because it's the one part of all these treatments that men may not know much about, or that it really has a lot of misconception about it. And men do hear about it, and they usually hear sort of misconception, I think, overall. And so there are, of course, risks to any surgery, every single surgery, infection, bleeding, and damage to surrounding structures. And there's a less than 1% chance of infection, much less than 1%. So it's a in summary here, because I do want to make sure we get to the Q&A. ED is a common problem associated with many other conditions, diabetes, heart disease, et cetera. There's a lot of treatment options. And, since we've covered the options now, I can just say, when I talk to guys about ED, I said, we have a solution. I can get you an erection, 100% guaranteed, because I can do the surgery and give you the erection that way. It just depends how far you want to go. And again, that's going to be different for every guy. And my oldest patient that I've done the surgery on is 86 years old. So, age is not the limiting factor, relationship status, et cetera. It's going to be what's right for you. And, what balance of maintaining this part of life versus, how far do you want to go down the road of things like injections or surgery. But certainly, if this is part of life that matters to you, we can give you solutions. And I think there's a lot to think about. We just talked about a lot of details. But I think the biggest overarching question is this an aspect of life that you really want to be able to maintain? And if the answer is yes, then we just start working through those treatment options and pick the one that's right for you. So if you'd like to go and read all of these articles and see if everything I said is true, you certainly can. And let me see, is my name on here anywhere? Let's spend a few minutes.
Keep going, sir. One more, I think.
Oh, at the bottom? Am I going to be at the bottom?
Yes.
Oh,
right after all the references. We got to make sure to cite everything that there.
I was looking for my name on the articles that were there. But anyway, so I hope that was of some value, and we definitely have a bunch of questions. Please use the chat function still if you have questions. There's a certain number, but